Hi, I'm Dr. Becky Coates with TMJ Plus Wellness Center. I want to share with you the differences of a mouthpiece, a bite guard, a sports guard, and what we do in our office, which is a TMJ orthodic. And it's kind of like, if you think about it, what are all those terms? They could be confusing, so you don't really know what you're getting and you're comparing apples to oranges. So first demonstration would be if you ever had something over the counter. Let's just say you went to Academy or online Amazon and you're like, I'm just clenching my teeth. I just need something now. I don't have time to make an appointment, and you're just in crisis mode. You might have had something that came in the mail and it just kind of looks like this. And so, I mean, this is something you can see that it's kind of flopsy. It looks like you can, basically what you had in football, basically back in high school. And so really with this, when you would bite into it and it would tell you in the package, warm it up on hot water and mold it, it's not really doing anything other than opening your teeth. So your teeth aren't crushing. Now with that, that's not going to help you in terms of where do your jaw muscles need to be. In other words, how far forward or side to side or back. This is not going to do anything with that. So this is what you would call an over-the-counter mouth guard or a sports guard. Basically only to protect teeth from contact. Next, we have a lot of people come in and they show us I've already had this, but how are you different? And I've already paid and done this, this, and this. And if that's you right now, you can definitely resonate with the emotional aspect of, I'm tired of making the wrong decision. What's right for me? This is what I see a lot of. This is what is made in our profession to help with teeth clenching. And so while that might help some people, it might not be right for you, and you might say, well, that didn't do anything for me, and you just don't do anything and get frustrated. Does that sound like you? I hear that weekly, and so this is what's called a occlusal guard or a night guard. And so basically it's custom fit for your teeth, so that's better than this one, but it doesn't have anything on the biting surface, the chomping surface, where it has you any sort of built-in grooves, like your teeth fit together, like they lock in together. This is just flat. So if you think about that, when patients put this in, they can move their jaw anywhere, so it prevented teeth rubbing, but it didn't really stop your muscles from clenching. It didn't stop your pinched airway or jaw from being squished all the way back toward your throat. It didn't do anything to support your jaw poppy clicking issues that you have because it didn't center your joint. That's called an occlusal guard. The other thing that we see is what's called, someone says, I had one of those NITI things. So they mean a NTI appliance is what they're talking about. And if you've had one of these, they custom fit it in your mouth, but you're only contacting here in the front, just like the edges of your teeth. So while you might think, well, my back teeth can't touch, so that's great because my molars that keep breaking and I have crowns, they're not touching. Here's the thing with this. These usually pop out, or people have fear of, I don't want to swallow it, especially at night. Or if they're only having their front teeth touch, what happens is they didn't have any contact on the back. So what happens is that the jaw joint, I'm going to show you my really cool slide. We call him Scully Man. What's here in your joint in front of your ear, they're not supporting your jaw joint called the TMJ, nor the supporting tissue that's called a disc. So it doesn't really help with that. And most people still have headaches with this in the point here, because if you have only heavy contact on your front teeth, you're always going to have pain here. Maybe not successful. Fast forward to what's called a orthotic. So you might say, well, everything kind of looks plastic like me. This is the whole purpose of the video, is to show you it's how it's made, or the where is my jaw, my neck, my muscles, and my joints. So let me explain that. So we have what's called a orthotic, sometimes known as a neuromuscular orthotic, which means nerves, muscles, jaw joint, all balanced. So when you bite together with the orthotic in your mouth, it is basically where it has grooves. I know it's clear in plastic, but I'm trying to show you this where you can see that there's edges built in. So with the orthotic, your teeth, how they fit together, are going to come in a more defined position where you're going to lock into place. It is not your current bite. Okay, let me repeat that. It's not your current bite. So this particular orthotic, what the intention is you have grooves to hold you. It's not flat like the occlusal or bite guard I showed you, and your dentist that specializes in this area is going to know that your muscles need to be at a certain position where they can't keep firing or being angry and pissed off and inflamed. Your masseter muscles, your temple muscles. So basically, your dentist, this is what I do, we use precise technology and computer dynamics to know what are the muscles doing, where does the jaw need to be for the muscles to be calm and not clench. Also, we have to take into account the jaw joint position. Where does your jaw joint on a 3D x-ray, and I have a separate video about what is a cone beam CT, where does my jaw joint need to be? For instance, if somebody's jaw joint and bite is further back towards their ear, they need to go more forward, like this, forward, okay? Which on little Scully Man would be like this, if you guys can see. We drop the jaw and move it forward. Drop the jaw and move forward. So your bite would need to be different to fix your TMJ position and also help with your neck position. Any of you have like pain back in the neck, it will be tied together to that. Also, as I mentioned, we're looking at what's going on with the muscles here, here, here to make sure they're calm and balanced. So basically, in a nutshell, an orthotic is, yes, it looks like plastic. It's not what your former appliances were. It's basically using technology to find, kind of like landing a plane, that right position to where your jaw is correct, not just open and close, front to back, side to side, in all 5 dimensions. And that's what's built into the orthotic. That's what we focus here. That's what's worn during the day. I will have a separate video that talks about nighttime TMJ orthotics. This one happens to be a micro O2, and it helps, don't drop it, right? It helps to hold your jaw forward so you don't go back and wake up with pain in the morning. Protects your joint, protects your muscles, also so you can breathe and have more oxygen, i.e. I slept better. I don't wake up and feel like exhausted on all the dry circles. That's a nighttime orthotic. So if we see you and we work with you, don't be surprised if you hear about a daytime and a nighttime version. That's all I wanted to cover with the different versions of orthotics, and I don't know yet what would be right for you. That's why we have to do our very detailed exam, 3D x-ray called a cone beam, to know exactly what's right for you. It's not something you can just call and say, I want that, I watched that on the video. We have to know what's going on with your body, your posture, your muscles, your joint. That's where the very detailed analysis and the exam comes in to know what we're able to do for you. I'm Dr. Becky Coates, aka Dr. Jaw Dropper. I look forward to seeing you soon.